Hello, future healthcare heroes. Welcome back to the channel. If you're preparing for the NCLEX exam, one area you absolutely must master is medication safety. It's not just about knowing the drugs. It's about ensuring every dose you give is safe, accurate, and aligned with best nursing practices. In today's video, we'll dive into 40 of the most critical and challenging multiple-choice questions focused on medication safety. From the 5 rights of medication administration to high-alert drugs, common errors, and patient safety strategies, we've got it all covered. Medication errors can have serious consequences, and as a nurse, your role in preventing them is vital. Practicing these questions will help you sharpen your clinical judgment, improve patient care outcomes, and boost your confidence for the NCLEX and beyond. So, whether you're just starting your NCLEX prep or reviewing key concepts before exam day, this video is your ultimate guide to mastering medication safety. Let's get started and take one more step toward becoming the safe, skilled nurse you're meant to be. Question 1. A nurse is preparing to administer warfarin to a patient with atrial fibrillation. Which laboratory value should the nurse review prior to administration? A. Hemoglobin. B. International Normalized Ratio INR. C. Serum potassium. D. Platelet count. Answer B. International Normalized Ratio INR. Rationale. Warfarin is an anticoagulant that requires monitoring of INR to ensure therapeutic levels, typically 2 to 3 for atrial fibrillation, and prevent bleeding or clotting risks. Hemoglobin may indicate bleeding, but is not specific to warfarin dosing. Serum potassium is unrelated to warfarin's action. Platelet count is relevant for heparin, not warfarin, as warfarin affects clotting factors, not platelets. Question 2. A patient reports a rash from penicillin in the past and is prescribed amoxicillin. What is the nurse's priority action? A. Administer the medication as prescribed. B. Notify the healthcare provider. C. Document the allergy in the chart. D. Give a test dose to confirm allergy. Answer B. Notify the healthcare provider. Rationale. Amoxicillin is a penicillin derivative, and a reported penicillin allergy suggests a risk of cross-sensitivity, potentially causing anaphylaxis. Notifying the provider ensures an alternative antibiotic is considered. Administering the drug risks harm. Documenting is important, but not the priority over preventing harm. A test dose is unsafe without provider orders due to severe reaction risks. Question 3. A nurse is administering insulin glargine to a patient with diabetes. Which injection site is most appropriate? A. Deltoid muscle. B. Abdomen. C. Anterior thigh. D. Gluteal muscle. Answer B. Abdomen. Rationale. Insulin glargine, a long-acting insulin, is administered subcutaneously, with the abdomen being the preferred site due to consistent absorption. The deltoid is used for intramuscular injections, not subcutaneous insulin. Question 4. A nurse is about to administer a medication but notices the patient's wristband does not match the medication record. What should the nurse do first? A. Administer the medication. B. Verify the patient's identity. C. Contact a pharmacy. D. Document the discrepancy. Answer B. Verify the patient's identity. Rationale. The right patient is a key component of the 5 rights of medication administration. Verifying identity using 2 identifiers, e.g., name and date of birth, prevents errors. Administering without verification risks harm. Contacting the pharmacy or documenting are secondary to ensuring the correct patient. Question 5. A patient is receiving intravenous heparin. Which assessment finding requires immediate action? A. Heart rate of 88 beats per minute. B. Activated partial thromboplastin time of 120 seconds. C. Blood pressure of 130 over 82 millimeters of mercury. D. Respiratory rate of 16 breaths per minute. Answer B. Activated partial thromboplastin time of 120 seconds. Rationale. Heparin, a high-alert medication, requires monitoring of activated partial thromboplastin time with a therapeutic range of 60 to 80 seconds. An activated partial thromboplastin time of 120 seconds indicates excessive anticoagulation, increasing the risk of bleeding, and requires immediate notification of the healthcare provider. The other vital signs listed are within normal limits and do not indicate an urgent issue. Question 6. A nurse is teaching a patient about a new prescription for lisinopril. Which statement indicates a need for further education? A. I will take it at the same time each day. B. I should avoid potassium supplements. C. I can stop taking it if I feel better. D. I will report a dry cough to my doctor. Answer C. I can stop taking it if I feel better. Rationale: lisinopril, an ACE inhibitor, requires consistent use to manage hypertension or heart failure. Stopping it abruptly can worsen the condition. Taking it at the same time daily aids adherence. Avoiding potassium supplements prevents hyperkalemia. Reporting a dry cough is appropriate, as it may indicate a side effect requiring evaluation. Question 7. A nurse is preparing to administer 5,000 units of heparin subcutaneously. The vial contains 10,000 units per ml. How many ml should the nurse administer? A. 0.25 milliliters. B. 0.5 milliliters. C. 1 milliliter. D. 2 milliliters. Answer: B. 0.5 milliliters. Rationale: to calculate 5,000 units divided by 10,000 units per ml equals 0.5 milliliters. Double-checking calculations is critical for high-alert medications like heparin to prevent dosing errors. Options A, C, and D result in incorrect doses: 2,500 units, 10,000 units, or 20,000 units, respectively. Question 8. A patient receiving morphine via 4-pump reports severe drowsiness. What is the nurse's priority action? A. Increase the infusion rate. B. Assess the patient's respiratory rate. C. Administer a PRN dose of naloxone. D. Document the side effect. Answer: B. Assess the patient's respiratory rate. Rationale: morphine, an opioid, can cause respiratory depression, a life-threatening side effect. Assessing respiratory rate is the priority to determine if intervention, e.g., naloxone, is needed. Increasing the rate worsens the risk. Administering naloxone requires assessment first. Documentation is secondary to patient safety. Question 9. A nurse is administering a medication via intravenous push. Which action best ensures safety? A. Administer the drug over 30 seconds. B. Verify compatibility with other intravenous fluids. C. Flush the line with sterile water. D. Use a large gauge needle for access. Answer: B. Verify compatibility with other intravenous fluids. Rationale: intravenous push medications must be compatible with concurrent intravenous fluids to prevent precipitation or adverse reactions. Administering over 30 seconds may not be appropriate for all drugs. Flushing with sterile water is incorrect. Normal saline is typically used. A large gauge needle is irrelevant for intravenous push via an existing line. Question 10. A patient is prescribed digoxin 0.25 milligrams daily. The nurse notes an apical pulse of 56 BPM. What should the nurse do? A. Administer the dose as prescribed. B. Hold the dose and notify the provider. C. Administer half the dose. D. Recheck the pulse in 1 hour. Answer: B. Hold the dose and notify the provider. Rationale: digoxin slows heart rate, and a pulse below 60 BPM in adults indicates potential toxicity or bradycardia. Holding the dose and notifying the provider is the safest action. Administering the dose or half the dose risks worsening bradycardia. Rechecking later delays necessary intervention. Question 11. A nurse is preparing to administer a transdermal patch. Which action is correct? A. Apply the patch to a hairy area. B. Remove the previous patch before applying a new one. C. Cut the patch in half for a lower dose. D. Apply the patch to the same site daily. Answer: B. Remove the previous patch before applying a new one. Rationale: removing the previous patch prevents overdose from residual medication. Hairy areas impair adhesion and absorption. Cutting patches is unsafe, as it may disrupt controlled release mechanisms. Rotating sites prevent skin irritation. Question 12. A patient is prescribed furosemide 40 mg for. The nurse notes bilateral crackles and edema. What is the priority assessment before administration? A. Blood pressure. B. Serum potassium. C. Oxygen saturation. D. Daily weight. Answer: B. Serum potassium. Rationale: furosemide, a loop diuretic, can cause hypokalemia, which is dangerous in patients with heart failure, indicated by crackles and edema. Checking potassium levels is critical. Blood pressure, oxygen saturation, and weight are important but secondary to preventing electrolyte imbalances. Question 13. A nurse discovers a medication error after administering an incorrect dose. What is the nurse's first action? A. Document the error. B. Notify the healthcare provider. C. Administer the correct dose. D. Monitor the patient for adverse effects. Answer: D. Monitor the patient for adverse effects. Rationale: patient safety is the priority after a medication error. Monitoring for adverse effects ensures timely intervention. Notifying the provider and documenting are necessary but secondary. Administering the correct dose without assessment risks further harm. Question 14. A patient is receiving intravenous vancomycin. Which finding indicates a potential adverse reaction? A. Blood pressure of 120/78 millimeters of mercury. B. Redness and warmth at the intravenous site. C. Heart rate of 82 beats per minute. D. Serum creatinine of 0.8 milligrams per deciliter. Answer: B. Redness and warmth at the intravenous site. Rationale: vancomycin can cause phlebitis, indicated by redness and warmth at the intravenous site, requiring immediate action to prevent complications. The other findings are normal and not indicative of adverse reactions to vancomycin. Question 15. A nurse is teaching a patient about warfarin. Which food should the patient limit? A. Apples. B. Spinach. C. Chicken. D. Rice. Answer: B. Spinach. Rationale: spinach is high in vitamin K, which antagonizes warfarin's anticoagulant effect, potentially reducing efficacy. Apples, chicken, and rice have negligible vitamin K and do not affect warfarin. Question 16. A nurse is administering a medication at 9 o'clock in the morning. The order states every 8 hours. When is the next dose due? A. 3 o'clock in the afternoon. B. 5 o'clock in the afternoon. C. 7 o'clock in the evening. D. 9 o'clock in the evening. Answer: B. 5 o'clock in the afternoon. Rationale: every 8 hours means a dose is given every 8 hours. Adding 8 hours to 9 o'clock in the morning results in 5 o'clock in the afternoon. The other times do not align with the correct 8-hour interval. Question 17. A patient is prescribed metformin. Which instruction should the nurse include? A. Take with grapefruit juice. B. Monitor for signs of lactic acidosis. C. Take on an empty stomach. D. Expect weight gain as a side effect. Answer: B. Monitor for signs of lactic acidosis. Rationale: metformin can rarely cause lactic acidosis, a serious side effect requiring monitoring, e.g., muscle pain, lethargy. Grapefruit juice is not contraindicated. Metformin is taken with food to reduce GI upset. Weight gain is not typical. It may promote weight loss. Question 18. A nurse is setting up an 4-infusion pump for gentamicin. Which action ensures safety? A. Set the pump to deliver the dose over 15 minutes. B. Verify the dose with another nurse. C. Use a macro drip tubing set. D. Administer without a pump. Answer: B. Verify the dose with another nurse. Rationale: gentamicin, a high-alert medication, requires double-checking with another nurse to prevent dosing errors. Infusion time depends on the dose and protocol, typically 30 to 60 minutes. Macro drip tubing is not specific to gentamicin. Pumps are required for precise delivery. Question 19. A patient with a sulfur allergy is prescribed sulfamethoxazole. What should the nurse do? A. Administer the dose. B. Hold the dose and notify the provider. C. Document the allergy. D. Monitor for rash after administration. Answer B. Hold the dose and notify the provider. Rationale. A sulfur allergy contraindicates sulfamethoxazole due to risk of severe allergic reactions. Holding the dose and notifying the provider prevents harm. Administering or monitoring after administration risks patient safety. Documenting is secondary to preventing harm. Question 20. A nurse is administering a PRN dose of lorazepam. Which assessment is most important? A. Blood pressure. B. Anxiety level. C. Respiratory rate. D. Pain level. Answer C. Respiratory rate. Rationale. Lorazepam, a benzodiazepine, can cause respiratory depression, especially with PRN dosing. Assessing respiratory rate ensures safety. Anxiety level is relevant but secondary. Blood pressure and pain are not directly affected by lorazepam. Question 21. A patient is prescribed 2 grams of ceftriaxone intravenously. The vial contains 1 gram per 10 milliliters. How many milliliters should the nurse administer? A. 5 milliliters. B. 10 milliliters. C. 20 milliliters. D. 40 milliliters. Answer C. 20 milliliters. Rationale. To calculate the dose, divide 2 grams by 1 gram and multiply by 10 milliliters, which equals 20 milliliters. Double-checking calculations for antibiotics ensures accuracy. Options A, B, and D result in incorrect doses of 0.5 grams, 1 gram, or 4 grams, respectively. Question 22. A patient receiving intravenous potassium chloride reports burning at the intravenous site. What should the nurse do first? Options. A. Increase the infusion rate. B. Stop the infusion. C. Administer a pain reliever. D. Flush the line with saline. Answer B. Stop the infusion. Rationale. Burning at the intravenous site indicates possible extravasation or irritation, necessitating immediate cessation of the infusion to avoid tissue damage. Increasing the infusion rate could exacerbate harm. Administering pain relief or flushing the line with saline should be considered only after stopping the infusion. Question 23. A nurse is teaching a patient about a new inhaler. Which statement indicates understanding? A. I'll shake the inhaler before each puff. B. I'll use it only when I feel short of breath. C. I'll store it in the refrigerator. D. I'll take 2 puffs every hour. Answer A. I'll shake the inhaler before each puff. Rationale. Shaking the inhaler ensures proper mixing of medication for effective delivery. Using only when short of breath may not follow prescribed maintenance dosing. Most inhalers are stored at room temperature. Dosing frequency depends on the prescription, not hourly. Question 24. A patient is prescribed levothyroxine. Which time of day is best for administration? A. With breakfast. B. Midday. C. Bedtime. D. Morning on an empty stomach. Answer D. Morning on an empty stomach. Rationale. Levothyroxine is best absorbed on an empty stomach, typically in the morning, to ensure consistent efficacy. Food, especially calcium-rich foods, can interfere with absorption. Midday or bedtime dosing is less optimal. Question 25. A nurse is administering enoxaparin subcutaneously. Which technique is correct? A. Inject into the deltoid. B. Aspirate before injecting. C. Pinch the skin and inject at a 90-degree angle. D. Massage the site after injection. Answer C. Pinch the skin and inject at a 90-degree angle. Rationale. Enoxaparin, a low molecular weight heparin, is injected subcutaneously by pinching the skin and using a 90-degree angle for proper delivery. The deltoid is for IM injections. Aspiration is not recommended for subcutaneous injections. Massaging increases bleeding risk. Question 26. A patient is receiving a continuous insulin infusion. Which monitoring is most critical? A. Blood pressure. B. Blood glucose. C. Urine output. D. Heart rate. Answer B. Blood glucose. Rationale. Insulin infusions require frequent blood glucose monitoring to prevent hypo or hyperglycemia. Other parameters are important but secondary to glucose control for insulin therapy. Question 27. A nurse is preparing to administer a medication but notices the label is unreadable. What should the nurse do? A. Administer the medication. B. Contact a pharmacy for a replacement. C. Use a similar medication. D. Document the issue and proceed. Answer B. Contact a pharmacy for a replacement. Rationale. An unreadable label violates the right drug principle, risking errors. Contacting the pharmacy ensures the correct medication is provided. Administering or using a similar drug is unsafe. Documentation is secondary to resolving the issue. Question 28. A patient is prescribed atorvastatin. Which laboratory value should the nurse monitor? A. Serum potassium. B. Liver enzymes. C. Blood urea nitrogen. D. Hemoglobin. Answer B. Liver enzymes. Rationale. Atorvastatin, a statin, can cause liver toxicity, requiring monitoring of liver enzymes, such as aspartate aminotransferase and alanine aminotransferase. Potassium, blood urea nitrogen, and hemoglobin are not directly affected by statins. Question 29. A nurse is administering a medication via nasogastric tube. Which action is correct? A. Crush extended-release tablets. B. Mix the medication with enteral feeding. C. Flush the tube with 30 milliliters of water after administration. D. Administer without checking tube placement. Answer C. Flush the tube with 30 milliliters of water after administration. Rationale. Flushing with 30 milliliters of water ensures the medication reaches the stomach and prevents clogging. Extended-release tablets should not be crushed. Mixing with enteral feeding risks interactions. Checking tube placement is essential to prevent aspiration. Question 30. A patient reports itching after receiving a new medication. What should the nurse do first? A. Administer the next dose. B. Assess for signs of anaphylaxis. C. Apply a topical antihistamine. D. Document the reaction. Answer B. Assess for signs of anaphylaxis. Rationale. Itching may indicate an allergic reaction, and assessing for anaphylaxis, e.g., dyspnea, swelling, is critical to ensure patient safety. Administering the next dose risks worsening the reaction. Topical antihistamines require orders. Documentation is secondary to assessment. Question 31. A nurse is preparing to administer digoxin. Which electrolyte imbalance increases the risk of toxicity? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypocalcemia. Answer B. Hypokalemia. Rationale. Hypokalemia increases digoxin toxicity risk by enhancing its binding to cardiac cells, potentially causing arrhythmias. Hyperkalemia, hypernatremia, and hypocalcemia are less directly related to digoxin toxicity. Question 32. A patient is prescribed albuterol via inhaler. Which side effect should the nurse monitor for? A. Bradycardia. B. Tremors. C. Hypotension. D. Hypoglycemia. Answer B. Tremors. Rationale. Albuterol, a beta agonist, commonly causes tremors due to its stimulatory effects. Bradycardia, hypotension, and hypoglycemia are not typical side effects. Question 33. A nurse is administering a medication at 2 o'clock in the afternoon. The order states twice daily. When is the next dose due? A. 8 o'clock in the evening. B. 2 o'clock in the morning. C. 6 o'clock in the morning. D. 8 o'clock in the morning. Answer: C. 6 o'clock in the morning. Rationale: twice daily means the medication is given every 12 hours. A dose at 2 o'clock in the afternoon means the next dose is at 2 o'clock in the morning or 6 o'clock in the morning, depending on hospital policy. 6 o'clock in the morning is standard for twice daily dosing. The other times do not align with a 12-hour interval. Question 34. A patient is receiving intravenous morphine. Which finding requires immediate action? A. Pain level of 4 out of 10. B. Respiratory rate of 8 breaths per minute. C. Blood pressure of 110 over 70 millimeters of mercury. D. Sedation level of 2 out of 4. Answer: B. Respiratory rate of 8 breaths per minute. Rationale: morphine can cause respiratory depression, and a respiratory rate of 8 breaths per minute is critically low, requiring immediate intervention, such as administering naloxone. The other findings are concerning but less urgent. Question 35. A nurse is preparing to administer a chemotherapeutic drug. Which precaution is most important? A. Wear gloves during administration. B. Administer in a well-lit room. C. Use a large-gauge needle. D. Mix the drug with saline. Answer: A. Wear gloves during administration. Rationale: chemotherapeutic drugs are hazardous, requiring personal protective equipment like gloves to prevent exposure. Lighting, needle gauge, and mixing with saline are not specific safety precautions for chemotherapy. Question 36. A patient is prescribed prednisone. Which instructions should the nurse include? A. Take with grapefruit juice. B. Stop the medication abruptly. C. Take with food to reduce GI upset. D. Avoid monitoring blood glucose. Answer: C. Take with food to reduce GI upset. Rationale: prednisone, a corticosteroid, can cause GI irritation, so taking it with food is recommended. Grapefruit juice may interact with other drugs, not prednisone. Abrupt cessation can cause adrenal insufficiency. Blood glucose monitoring is needed due to hyperglycemia risk. Question 37. A nurse is administering a medication via IM injection. Which site is most appropriate for an adult? A. Vastus lateralis. B. Dorsogluteal. C. Deltoid. D. Rectus femoris. Answer: A. Vastus lateralis. Rationale: the vastus lateralis is the preferred IM site in adults due to its large muscle mass and low risk of nerve injury. The dorsogluteal is avoided due to sciatic nerve risk. The deltoid is used for smaller volumes. The rectus femoris is less commonly used. Question 38. A patient is prescribed nitroglycerin sublingual tablets. What should the nurse teach the patient? A. Swallow the tablet with water. B. Take up to 3 doses 5 minutes apart. C. Store the tablets in a warm place. D. Take the dose daily at bedtime. Answer: B. Take up to 3 doses 5 minutes apart. Rationale: nitroglycerin is taken sublingually for chest pain. Up to 3 doses 5 minutes apart if pain persists. Swallowing reduces efficacy. Tablets should be stored in a cool, dark place. Daily dosing is not typical for PRN use. Question 39. A nurse is preparing to administer a high-alert medication. Which action is most important? A. Administer the medication quickly. B. Verify the dose with another nurse. C. Document the administration first. D. Use a filter needle. Answer: B. Verify the dose with another nurse. Rationale: high-alert medications, e.g., insulin, heparin, require double-checking with another nurse to prevent errors. Administering quickly risks mistakes. Documentation follows administration. Filter needles are specific to certain drugs. Question 40. A patient is prescribed fluoxetine. Which side effect should the nurse monitor for? A. Hypertension. B. Weight loss. C. Hypoglycemia. D. Bradycardia. Answer: B. Weight loss. Rationale: fluoxetine, an SSRI, can cause weight loss as a side effect. Hypertension, hypoglycemia, and bradycardia are not typical side effects of fluoxetine.